Hello, everybody, and welcome to Social Work Week 2024. My name is Matthew Devlin, and I'm the Head of Strategic Engagement at Social Work England. It's a great honour and pride that I get to open Social Work Week 2024 and also get to introduce this opening session, which is envisaging the future of social work in England. During the next hour, you'll hear from Colum Conway, who's Social Work England's CEO, Beverley Tarka, who's the President at the Association of Directors of Adult Social Services, and Kate Concannon, who's a principal social worker and also a member of Social Work England National Advisory Forum. Before I hand over to Colum, there's just a few housekeeping slides for me to go through, so just bear with me before we get to the speakers. So the legal disclaimer that you see on your screen there. So any views, information or opinions expressed by third parties during Social Work Week are the speaker's own and do not necessarily reflect the views of Social Work England or its employees. Social Work England have not endorsed third-party content. Social Work England accepts no liability for the content of third-party or sector-led sessions during Social Work Week. Your privacy is important to us. By providing personal information such as your name, email address, you agree to us contacting you for the purpose of event management and evaluation. Your personal information will be used solely for this purpose, solely for the purpose that it's collected. Your personal data will be retained for up to 3 years in accordance with our data retention schedule.
Thank you, Matthew. And welcome everyone to Social Work Week. So this is the first session of what are 21 sessions that we are having this week based around Social Work England, which is absolutely fantastic. 21 sessions. So you're the first guys to have a go at this. There are also 40 other sessions that are being delivered independently. So this is really exciting for us at Social Work England. This is our fourth Social Work Week, and it's building all the time. So really pleased to be here to get this opportunity to launch Social Work Week with you, and also to be able to launch it with Beverley and Kate. Looking forward to hearing what they have to say to us and their reflections on envisaging social work going forward. Part of Social Work Week, we're also today launching a campaign called Change the Script, and it's a campaign about how social workers are portrayed in media and TV. We did a bit of research earlier this year on perceptions of social work, and it was interesting that a key theme that came through that all the time was how social workers were disappointed in how they were portrayed in media and TV, and that it kind of felt at times that they were kind of undermining their professionalism and the professional standards to which they work to, and the level and expertise and complexity of their work. And so we kind of thought, well, it might be useful or interesting to kind of try and develop an idea around shifting that notion. And I mean, that works alongside others, including the unions and the representative body BASW and others who have been looking particularly at media and TV and trying to encourage media and TV to present social work in a different way. And we think it's quite important. I mean, one of the key reasons for that, I think, is that not everybody will experience a social worker in their lives, and in the way that we all experience, for example, teachers or doctors or nurses. So we will have a perception of that profession that is based on our experience, and that's kind of important. It gives us an important benchmark. Whereas for a lot of people who don't experience social work, then the only perception that they really get, the kind of public perception of social work, is a kind of an inaccurate misrepresentation of social work in the media. So I think we're all keen, and certainly since I've come into post and we've been here, lots of people have said, you know, one of the things they'd really like to see is kind of how social work is portrayed in TV being challenged, and move forward, as that's the way a lot of people consume and set their perceptions around social work. So we have started that campaign today. It's called Change the Script. I have been up since 6 o'clock this morning doing radio interviews, and have a load more radio interviews to do for the rest of the day, which has been really good. And the few interviews I've already done, the presenters have said, well, I don't really have any experience as social worker. I don't really know a lot about social work. So when EastEnders portray someone as taking children into care, is that the sort of thing you're challenging? And it was good to be in a position to be able to confirm that and say, yes, it's really that quite narrow, stereotypical role of social work that I think we need to consider in greater detail. So it's been a useful start to this campaign. As part of the campaign, we made a video of a couple of young men who were prepared to share their story about their experience of social work and how that's different. Because the other important element of how social work is portrayed in the media is it also portrays those who have lived and learned experience of social work quite poorly as well, and doesn't show the impact that social work has on people's lives, and the different kind of approach that can mean that the impact is significant and life-changing in a very positive way. So quite often that portrayal of people in the media and TV needs to be challenged as well. So we had a go at putting a video together, and I think we're going to play it now, Matthew. Hopefully this technology works, and we get to see just a short video, a short reflection of a couple of stories about people's experience of social work.
Back when I was with child protection, my life was really intense. I was having lots of family issues at home and issues with education.
My mum was in the hospice. I felt like I had a straitjacket on like 24/7. I knew I had to be strong, you know. But deep down inside, I'm being torn apart.
I met Sonia when I went into care. A lot of people think social workers are gonna swoop in and make choices for you, but actually it was more being empowered and to do things for myself.
Sharon was one of the social workers there. She knew what I was thinking before I even thought it. As opposed to like a traditional counsellor, she gives me prompts, she helps me with resolutions, she helps me to move forward day by day.
Social work is very much led by you. They're there to empower what you want.
I think after that first session, I was like, okay, I need this. 100%. If I'm being brutally honest, like, Sharon saved my life, you know? She listens, she understands, make me feel that everything's going to be all right, because the only other person that did that was my mum.
At first, I had the big impression that social workers were here to come take me away from my mum. But actually, it's like, you know when you're running a race and there's someone waiting for you at the finish line? Sonia is that person at the end of the track.
Sharon changed my life, and I will be eternally grateful forever.
So there you are. I think it's quite a powerful and moving depiction of the impact that social workers have had. And you of course will have a lot of those stories and a lot of those experiences yourselves. I mean, in the end, the identity around being a social worker is all about the work that we do. I really enjoyed the reference to empowerment, and that social worker had brought empowerment to a young man's life, which I think was really strong and really healthy. And I really like the reference to bereavement and that kind of element of social work that is often quite missed and forgotten, particularly around media and TV. So really pleased today that we have Beverley here, who will be able to flesh out more kind of the direction of travel for social work in adult social care, and shifting that perception, shifting the narrative around social work and what the priorities are for the workforce. And later on this afternoon, in one of the second or third session of our day today, we have a session around Let's Talk Children, and it's a session that's been delivered by Isabel Trowler, our Chief Social Worker for Children, and the team at the FE who are working on the implementation of the recommendations from Stable Homes Built on Love, the kind of new direction of travel for children's social care. And so they'll be able to outline how that direction is envisaging a different kind of role for social work in terms of where the emphasis is and how social work can be developed in working with children's and families and within a broader kind of family support context. And I think that's really interesting development. It'll be interesting to see how it evolves over the next few years. Of course, a lot of local authorities are already working in this way. So there are kind of two key directions for social work over the next period of time, and that will be discussed as we move across the week. We've a lot of sessions, as I said, 21 that we have focused on, and 40 further sessions that will be part of Social Work Week. So absolutely delighted to be kicking off and also aligning it with the campaign. And just to say that the campaign has kind of arisen out of one of the recommendations around Stable Homes Built on Love about building confidence in social work. And we have received a small bit of funding from the Department for Education to put this campaign together and to make the video. So we're pleased to do that. It's also kind of testing the ground for us in terms of this type of work and how this lands. And if it lands well, there may well be other phases of work, but we just wanted to test the water with this one and see how well it goes. So hopefully the campaign will gain a little bit of traction over the week as well. I mean, some of the other interesting things that's happening across the week are, lots of focus on mental health, lots of focus on leadership, lots of focus on promoting diversity and cultural sensitivity, which is, of course, a key area at the minute. A lot of a really nice session coming up on kinship care, which is one of the key areas for development across children's social care. And there's also a fascinating program, I don't know if you've signed up for it, Why Pets Matter in Social Work, which is an interesting one and fascinating and hopefully should be very entertaining. So looking forward to all of those sessions going forward. As I said earlier, we based some of the campaign around research that we had done earlier in the year around perceptions of social work, and that line that came up was directly from that research, where it says 1 in 10 social workers think do not think their role is well enough respected in society. So I think part of what we're doing around Social Work Week is talking to one another about how we can build confidence in social work, and also focus on how we can develop our own practice and consider ways in which we continue to develop our professionalism, reach our professional standards, and work on constantly developing and growing our practice. There's always room for improvement. I like to use the phrase, the road to quality is always under construction. So we always must believe that there is more that we can do to constantly improve. The other couple of research pieces that we've done this year was focused on the workforce, and there are some difficult messages in that research in terms of how people feel about their work, morale within the workforce, how they feel about the opportunities they're getting for advancement. And I think that's kind of helping us feed into other collaborations. I've always been very keen to ensure that Social Work England had at its heart collaboration as part of what it does. And I think we've worked hard to be as collaborative as we can be and try and facilitate a process where the system comes together and acknowledges itself as a system, and that no one person has a single answer to the issues and concerns that social workers have across England and indeed across the UK, but that there's a power in the collectivity, there's a power in the system that we can work together to try and address some of these issues. And Social Work England has a couple of levers. That's all we have. We certainly can't solve all the issues and address all the issues on our own as the regulator for social work, but we can collectively engage in powerful relationships and systems that will help move that forward. And I thought it was interesting that we had a workshop recently, and someone talked about, you know, the idea and thinking of systems when it comes to working with families and people with mental health issues and people who are struggling within the social context within which they're living. And yet we don't apply that same system logic to how we address some of the issues and some of the areas and concerns we have for social work. So we're pushing really hard at trying to take that systems approach. We have and have had for the past year been meeting regularly with other senior leaders across the social work system to try and see if we can facilitate a process whereby a collaboration can take place and some of the key issues resolved in that way. And we're continuing to do that. There was, as I say, a workshop in January that was facilitated by the Association of Professors of Social Work, and we are now, Social Work England are going to facilitate a follow-up workshop on that process in May, June time, and we've been working on a round table to try and see if we can get a kind of consensus around what needs to happen within the system and who needs to work within that system in order to make it happen. The other piece of research that we did, and there will be that research around workforce and perception will be developed further in a session on Thursday of this week. And there will also be another session on practice educators. The third piece of work we did was on practice educators, the role of practice educators and how important that is. Now, we believe that the practice educator role is really important in the education and training of social workers, that what happens in initial education and training is a pathway to the profession and into social work. And an important part of that pathway is the practice piece. I mean, that's absolutely crucial. So the role that practice educators play in that practice piece is really important. And we've underpinned that in our own work around readiness for professional practice, which is guidance for education and training in social work. And we believe that there's a lot we can do in terms of developing education and training in social work to ensure that social workers are better ready for the profession and better ready for the transition from education and training into the profession. And we're working alongside the Department for Education now in terms of the early career framework, which is also part of the response to the review of children's social care and the current reforms. So we think it's really important that early career framework, first of all, works for the whole workforce, for the whole of the profession, because that's the most important thing for us in terms of maintaining a connection for the whole profession of social work, but also is part of the process of education and training and part of the process of developing the profession and part of the very important process of transition from education and training into social work. And I know we have the ASYE program and it works extremely well in many areas and not so well in some, and we would like to see how this might develop a consistency across the piece. So those are some of the key areas that we're working on to try and see if we can collaborate and move things forward. And I hope you'll find that this week will be a useful week. I hope you manage to get a wee bit of space to get yourself down for a couple of sessions and just take the opportunity to reflect and grow, to talk to peers, to talk to one another, and take a bit of time to reflect and think about social work, what you do in social work, what works well, what needs further development, and what some of the big issues are that we collectively need to focus our energies on to ensure that we can continue to build a strong profession that's responsive to the needs around it and the needs that it encounters every day. So brilliant that you're here, brilliant that we've got a start. And I'm keen now to hand over to Beverley, who is going to talk to us about kind of her reflections on her year as president of ADSS, and also about kind of the shifting work and shifting workforce priorities for social work in adults. So over to you, Beverley, and thank you so much.
Thank you very much, Colum. And first of all, just want to start by thanking Social Work England for the invitation to speak at this beginning of the celebration of Social Work Week. It's a real pleasure to be here. As Colum has said, I'm the president of ADAS for the current year. I'm also the Director for Adults, Health and Communities in the London Borough of Haringey. And this morning, I really just want to reflect briefly on 3 areas. I was so pleased to watch the video entitled Change the Script, because that has a real resonance with the first thing I want to talk about, which is the need for all of us to shift the narrative about social care and, by extension, the work we do as social workers. I also want to briefly focus on the ADAS Commission report into the future of social care, which we entitled The Roadmap, Time to Act. And then I'll be focusing on professional practice in adult social care, the important role that PSWs play alongside us in ADAS, and very much a focus on the developing workforce strategy and a focus on equalities, diversity and inclusion. So first of all, looking back just a few years, the way that many of us in social care spoke about our sector could often be heavy with the language of crisis, scarcity, deficits, and burdens for very understandable reasons. And we at ADAS firmly believed that we were painting ourselves into a doom loop, where a series of beliefs, actions, and reactions work to reinforce negative beliefs and unwanted behaviors. And one of the negative consequences of our doom loop was that it risked characterizing the people who draw on care and support as problematic. Thankfully, people who draw on care and support have raised their voices to object to this framing. And by listening to them and working alongside them, I believe that our sector's story is changing. Our story now starts with people, not provision. It starts with everyone's wish to live in a place we call home, with people and things that we love, in communities where we look out for one another, doing things that matter to us. That's the glorious vision that Social Care Futures has developed, and which I believe is a guiding principle for all of us in this sector. Starting from here, social care isn't a story of deficits, but really of contribution, interconnection. And as I said just a minute ago, ADAS published Time to Act, a roadmap for reforming care and support in England. And step 1 was to reimagine care and support with people who draw on it. In other words, we recognize that we have to be serious about changing our story. And changing the script, I think, is an excellent example of how we are going about doing this. So we know a social care story that underlines the dignity and agency of those who draw on care and support is by definition a story that affirms the value of the people who work in social care. The descriptions of social care that I, and I'm sure all of you identified with, is better relayed through action phrases. And we heard some of them in that script, that short video. The fight for social justice, the fight for equality, making a difference, courageous, caring, improving lives, saving lives, giving people hope, empowering, safeguarding, inclusive, humane. I could go on and on. As social workers, this is the work we do, and this is the story we have to get in the public domain. So, as this slide shows, as we've reflected in the roadmap, Time to Act, adult social care is fundamental to society. There's some really important stats out there that I think we have to be better at articulating. We have a bigger workforce than the NHS. We're supporting people to live good lives right now, and social workers, all of you here, are leading this. And this framework for change, actually, we think is a really useful tool for all of us to embrace as a guiding framework for the work that we all do. You'll see as you read through the roadmap, all of the recommended actions build towards 8 features of a better care and support system. This is the destination of the roadmap. The first 3 describe the care and support experienced by people who draw on it and their carers. The second 2 describe features of how the system of care and support is organized, and the other 3 are wider and relate to how social care is experienced by all of us as citizens. We can go on to the next slide, please. It sets out a range of actions for organizations, national, local government, commissioners, social workers, every people within the social care sector. And it's important to note that a lot of this transformational activity requires leadership, whether it's leadership by directives of adult social workers, leadership by social workers, principal social workers, all of the professionals working in this field, and fundamentally leadership of people who receive care and support. The voices of people with lived experience is critical to developing our improvements going forward. So in short, the actions are underpinned and informed by co-production with people who draw on care and support their families and carers. I'd like to go on, if we can go on to the next slide, just to talk about the role of professional practice in adult social care. It's very clear, the evidence is there. Social work has led the way. We know the principal social worker role was enshrined in the Care Act in 2014. Principal social workers have joined with AMPS leads, principal occupational therapists, lead social care nurses to drive excellent practice in adult social care. And they have principal social workers have a real key role in leading delivery of the Care Act and in the CQC assurance process. Just pausing briefly on the Care Act, if we were really fulfilling this, we would be working holistically with a focus on prevention. How can we make the case for this and for social workers to work in this area? As a DAS, I know the challenges within local authorities, social care having perhaps 2/3 of the budget, finances being squeezed, and very often we have to make the case with our Section 151 officers to support us continuing to have that focus on preventative activity. So there's a real challenge for us, for the social work profession, to support the shift away from acute care, to focus more on prevention and early intervention. And I'd just like to put out a call for all of you to help us with our conversations back in our local authorities. If you have good examples of work like this, please let us at ADAS know. Sharing stories with ministers is what helps us to change the narrative and ultimately the direction of travel. That is so important. Colum talked about stories and changing the narrative of stories, and that is so critical to the future sustainability of adult social care. So ADAS is really working to shift government towards this way of thinking. And very often we come together and we talk about what's the next big challenge. From a personal perspective, I don't feel the social work voice is as heard in the integrated care systems as loudly as it should be. What do you feel about it? What does it mean for social workers? How can we work together more to move towards prevention? Have we been able to do this to date? Can we showcase areas and examples of practice where that is really working? Again, really would love to hear from you. So moving on to the next slide, I just really want to talk about ADAS and its role with principal social workers. And as many of you will know, PSWs are now a discrete membership category within ADAS and have been since 2019. They're part of the executive, they attend spring seminars as presenters, participants, and we now have a workforce group dedicated to professional practice issues. And we're advocating for a workforce strategy in social care that covers the whole sector, from frontline care workers to experienced, professionally qualified practitioners. And we're really pleased to support the work of Skills for Care in this space of developing a national workforce strategy for adult social care. We feel this is a really important opportunity we need to seize to prepare whatever the next government is with the possibility of what a focus on a 10-year workforce strategy can mean for the sector. And very much it's a bottom up. We're numbers of subgroups that have come together to input into that strategy. And another theme of the way we work is really around collaboration. So again, all the network groups within ADAS, the professional groups, the PSWs, etc., really will be in a position to contribute to this strategy. I can move on to the next slide. Just to focus a little bit around the work we're also doing in ADAS around equalities, diversity and inclusion. And I must say that principal social workers have been key partners in pushing forward this work. There's an EDI work stream within ADAS, which is driving our work, and PSWs are key participants. They've led and promoted the use of the RES, and a recent report highlighted the data which the RES has produced actually has shown that we still have a very long way to go. Social workers have challenged ADAS itself to change and support the development of future global majority social work leaders. And I remember my immediate predecessor, Sarah McClinton, the immediate past president, and myself, we were challenged around the lack of diversity in the mentoring associates pool within ADAS. And with recent springboard cohorts, although it must be noted that that program is currently paused due to a lack of a sponsor, we have chosen to try and prioritize people from diverse backgrounds to apply to the program. But there is so much more to be done. So if I could just conclude by just briefly saying, together, I feel we can go far. It's something I often say. If we work alone, we can go fast, but the results will not be as they should be. I think there's something about acknowledging the fact that ADAS was originally formed by social workers who rose through the ranks to be directors of their local authority social services departments. And even if not every DAS these days has that background in social work, we need senior leaders who are social workers. So again, my final challenge to you is, which of you out there in the audience will be a future DAS, director or professional lead for social work in your organization, as well as leads in everyday practice? I hope many of you will step up to that challenge. Thank you very much, and I'll end my comments there. Thank you.
Just it to be me who doesn't unmute. Thank you, Beverley, for that. It was really, really interesting, and I hope there'll be some questions at the end. So I was invited to speak today by Matthew, and I think he introduced me earlier. I'm a PSW and head of service down in Southampton in adults, but I'm also a member of the National Advisory Forum for Social Work England. And this is a group of 20 of us with lived and learned experience of social work. We act as a critical friend to Social Work England, advising on engagement with those who have an interest in social work. And we also work together on developing projects and other subgroups, working with other forums. We make recommendations to senior and executive leadership teams, and we also support Social Work England in promoting their role as our regulator for social work. So Matthew, when he invited me, he said to talk about social work and my journey into social work. And I guess we all have our own story that has brought us to social work. And there's nothing particularly special about mine. But what I do hope for is to able to express the kind of breadth of social work, and actually just to remind us what an amazing career social work really is. So in a lot of ways, I think I was destined to go into some kind of career that was a caring profession. My mum was a nurse, but I just can't stand the sight of blood. And although as a social worker, you do see blood at times, I'd have been a really rubbish nurse. My mum also fostered. So I knew about social workers, I knew they existed, but I didn't know a lot else about them. And back in the 80s and early 90s, you couldn't do a social work qualification at 18. So I was thinking I'll go off and do a sociology degree and plan to be a social worker later on. I didn't realise how long it would actually take me. So I didn't do a degree at that point. I didn't go to university. At a young age, there was the typical boy meets girl scenario, and I went off and started a catering business. And whilst I love eating food, and in many ways it was a successful business, I was really fortunate. I've cooked scones for who is now the king, was Prince of Wales back then. It always felt like hard work. I didn't feel a passion around making scones. And then unfortunately, my neighbour's very young child was murdered within their family. And it just got me really thinking back again about social work and child protection, and made me realise that making sandwiches just wasn't for me. Long story short, boy and girl separated. A little while later, woman meets a very supportive man, and we started fostering. But I felt like I wanted to do something more. So I went on to do my maths GCSE, did an access course, and completed my social work degree. I've spent 9 years in children's social work with children in care, in a child protection team, and working out of hours. And I had a love-hate relationship with the job. Always loving social work, but obviously having those really difficult days when my colleagues and I would talk about our exit plans, whether that was opening an art studio, a dog kennels, or a gin distillery, or even working at Waitrose for the discount. However, those who know me may tire of me shouting about from the rooftops how the social work degree is just the best thing that anybody could do. It's a key to travelling the world. You can be privileged to work with people of all ages in all kinds of different situations, but it's not always that easy. And actually, the average length of a social work career is only around about 8 years. And I think Laura Cook from the University of East Anglia has talked about critical career incidents. You know, those situations when you believe that you just can't go on in social work anymore. However, I'm quite stubborn, and having worked to get my degree, I wasn't going to give it up and go and set up a gin distillery. And my mum always used to say, a change is as good as a holiday. So I ended up working in public health as a local area coordinator, and I worked out in the community for a couple of years, really learning what strengths-based practice was all about. We didn't have a budget, and we relied on individuals in the community to support each other. That programme ended where I lived, and interestingly, after spending time as a teenager visiting my brother on secure mental health wards, I'd always vowed never to work in mental health. And yet I still ended up working in a community mental health team. And they even started a master's in mental health recovery and social inclusion. And it was here that I realised that my assumptions around adult social care was completely wrong. I'd always felt like a children's social worker, and I just thought that was what I was. And I really liked it in the video earlier when the young man was saying about he felt like his social worker was standing at the finishing line, because I can remember feeling like that as a social worker, standing at the finishing line, supporting young people. But when I came into the mental health teams, I really started to see the complexity of the legislation, the championing of human rights and social justice that was going on in adult social care. And I think I'd been blinded to that. I hadn't realised that this was going on. I had become a practice educator, and I went on to do my best interest assessor training. And I think we saw from the video the social workers in palliative care, and I've got friends who work with refugees. So I guess just the explaining really how broad social work really is. And many of you will be from different situations, different workplaces here today. I guess what I'm trying to kind of get across is wherever you are on your social work journey, it's not a straight road and there's lots of opportunities. I think last week there was a article in The Guardian where Ruth Allen talked about many people joining social work as career changers. And actually, social work is a career that changes. It changes our lives and it changes the lives of the people we work alongside. So next time you're having a bad day or experience a critical career incident, I'd really urge you, don't leave the profession. The world has got enough gin distilleries. Just think about, is there another direction for social work? Even in the same services, in adults and children's, we've got short-term teams, long-term teams, specialist teams. We've got non-statutory social work, statutory social work, an increasing number of social workers within the NHS, social workers in workforce development and social workers in academia. And one thing for certain is as a social worker, we never stop learning wherever we are. So if you're not happy today where you are, please don't leave social work as a career because there are so many opportunities. And I really think my mum was right. A change can be as good as a holiday. And I just encourage you all to, love social work as we do. Thanks, Matthew.
Thanks, Kate. I'm going to keep you on screen because I'm going to bring everybody else on screen because we do now have some time for questions. We have had some questions posted already. We've got some really good ones to ask everyone, to all the presenters. But if people have got some, just encourage you to add them into the Q&A, and we've got a little bit of time now to ask some questions. So just 2 seconds while I bring everyone back on screen. And we will kick off with, I think, what was the first question that was posed. I won't share people's names just in case people who posted the question. I'm happy to have the names shared. But I suppose this is maybe a question to Colum, but will the change the script influence the understanding of social work in the political landscape and in politics?
Thanks, Matthew. And I have to say, I'm very impressed by how you're managing all this technology. We're all on screen, which is great. Well done. I look at, these things are often quite incremental. You try very hard. I mean, Beverley talked about the role of ADAS now and trying to change the narrative in the broader context of social care. So not just to see social care as how to manage hospital waiting lists and how to get people out of hospitals, or some sort of deficit model that's like sucking the life out of our economy, but in actual fact is a major contributor to society and a major contributor to how society works and how it works, and creates that framework. And it's the same in children's social care. As I was saying that the emphasis is really all about empowerment, strength, what is in our community to support people, what is within families to support people, how can we move that forward. And I think that's an important part of the narrative, not just social work in itself per se, but the context within which social work works. So it's not about it's about changing people's lives. So can a campaign do it? I mean, it's a help. It definitely is. How far we can push that video out into the mainstream is hard to know. We're not really attempting to do that at this stage, but that might be something that we'll do in the next stage. But yes, certainly, we're all at this level. Beverley, myself, other leaders across the various organizations are trying very hard to shape and influence the nature of policy in the departments and the nature and shape of social work within government. And of course, that's totally reinforced when you hear Kate and the brilliant story, her narrative and the brilliant story that is brought to life. And I think actually that's probably the most important thing of all, that we are able to bring people's real experiences to life. I thoroughly enjoyed that presentation, Kate, and I think that it's a combination of all of that. I think Beverley's call to arms is the right one. You know, there's no one single solution, there's no one single campaign. There's no one single thing will shift the dial, but I think collectively we can do a lot more than we believe we can.
Thanks, Colum. And just following on from that, there was a question around where's the campaign video shared?
So, and I should have said that. How remiss of me to not say that. That was the people in the media told me that's the basic message. Don't get it wrong. So they are. So it's on our website, socialworkengland.org.uk, and it's /about social work. So we were trying hard to see if you could just put search about social work and the video would come up. So we're hoping that will happen over the course of the day. But at this stage, if you go into our website and go into about social work, it's there for you, and we'd really encourage you to share it across all your networks, and bring it as much to life as possible, because I think the young men who told their stories and the social workers in that video, it's quite powerful, I think.
Thanks, Colum. And you touched on it a little bit when you were talking there around the sort of collective power to drive the profession forward, and there's been a question sort of around that, and I'll come to you first, Beverley. So how does Social Work England, ADAS, and I suppose ADCS as well, and the PSW network, how do they work together to drive forward change in the profession?
Thank you very much. So I absolutely agree with Colum. I think Change the Script is but a part of the story, and it's really through that collaboration and coming together. So at the end of INCAS, we had a fringe event where we invited sector leaders to come together and really to sign up to this campaign to change the narrative, to raise public awareness around social care and what the sector actually does in a really positive way. ADAS as an organisation has actually committed at that same INCAS conference at our governance meeting to invest significantly in supporting the campaign. But we recognise, as I said earlier, we can't do it on our own. And that's why Change the Script is such a fantastic part of building that story. Our comms leader with a director within ADAS is actually actively working on a campaign. But actually, as I said earlier, that has to be collaborative, reaching out to all the sector leaders to support. So to your question, PSWs, workers in the field, people in receipt of care and support, they are all leaders in this area. It's not just the people that hold a sort of directorate. We want to hear from all of you. We want your stories. We really want to blitz public awareness around the positive aspects of adult social care. And politicians, you know, to go back to the previous question, they listen to their constituents, they listen to the public. So I believe it's the public we have to reach in order to then reach out to politicians. It's not an easy task, but we're really determined to really be part of that story going forward. Thank you.
Thanks, Beverley. Kate, anything to add, particularly from a PSW perspective?
Yeah, because I didn't actually say, but I'm also one of the vice chairs for the National PSW Network, and completely echo what Beverley's been saying, that actually there are lots of people in lots of different organisations working together for this. I know that BASWA have got their journalism awards as well in regards to improving the kind of journalists' views and what they're putting into the papers and on around us, hence the Guardian interviews and things last week, I believe. So yeah, just that everybody is heading in the same direction. I think we share the same vision, and in fact I've even got Social Care Futures vision just there. I always have it by my desk. But also about with children's as well, you know, it's social work altogether, because we are one profession. I am an adult social worker now, PSW in adults, but I'm a social worker first and foremost, and that brings together my experience of children's mental health and adults. And I think that that should be perhaps thought about a little bit more about, how we are a profession as one profession, which I know Social Work England's very supportive of.
Thanks, Kate. Anything to add, Colum? Because I know we've done a lot of work over the last 18 months, around that sort of collective power within the profession.
Yeah, so I mean, I was referencing earlier the kind of the workforce roundtable that we've been trying to keep going and to trying to take a systemic kind of view, on some of the issues. It is easy, in fairness, for all of us to get together and wring our hands and collectively rehearse the issues, and we do that. We're very good at it, but what we're very keen to is to move the conversation on now and see, well, where are the solutions and who owns some of those solutions and how can we collectively encourage. I've had the opportunity to spend a bit of time with both PSW networks in children's and adults, and also there was a lovely event earlier in the year in Birmingham where the two groups were kind of brought together and on a conference day. And I've certainly come away from that believing strongly that the PSW networks are really important platforms. And that's, as Kate has put very well, it's because they're grounded in practice. And that's the most important thing. I mean, I'm a social worker by background. I'm not registered anymore, and I couldn't be a social worker or do anything that social workers currently do, but I do have that background. But so I can't represent social work in the way that Kate can, and in the way that Beverley can, and in the way that the people who work for an ADSC and other networks, including absolutely BASWA and the unions. We had put out about the campaign. And the Social Work Union come back and said, look, we've been doing this work over the last number of years, and we've agreed to meet up with them and see if we can connect that and also connect with BAS's work. So that's the challenge. You just keep adding your voice. So all we're trying to do here is just add another voice to this sort of campaign, and those voices will come from all sorts of different angles. I think the key for us now and the challenge for us is how much we can talk, as Beverley said, how much we can talk to one another and actually make sure there's a level of alignment and a level of direction of travel that we're all committed to. And I think increasingly I get a feeling that that's beginning to take hold within the profession and in broader children's and adult social care, and that's I think that can only be for its betterment.
Thanks, Colum. Firstly, I've got to apologise because I'm super conscious that I'm trying to manage these questions coming in, which I naively thought there wouldn't be many, but we've been absolutely inundated, which does require me to look at this screen. So if I look a little bit, you're having to look at my side profile whilst I do this, but I'm trying my best to manage this. We've had a few questions coming around retention, and I know it come up when you were talking, Kate, around the sort of average career span for social workers around 7 years, and I know that typically focuses on sort of in frontline practice, because the social workers go off and do lots of incredible roles and offer real value to them. But I suppose just to open it up to everyone really around how do we resolve an issue like retention in a profession that's really challenging. Kate, I'll come to you just because you already sort of touched on elements of it.
I think it is going back to thinking about social work as a profession, and actually there's so many different roles within that, and actually different roles suit people at different times in their lives. So we have different chapters in our lives. So when my children were young, it really helped me to work in a short-term team, because it was a very different kind of work than perhaps one of the longer term teams. And then it's as my children have grown up and left home now, I've got involved with the network, and there's so many different opportunities outside of actually paid employment as well, which kind of really keeps me going to the event that Beverley was talking around, like NCAS, and meeting people who draw on services and listening to people's life stories and things like that just keep me really motivated. But we have to accept that it's really challenging times as well, and seeking support through supervision. And if you're not getting that supervision, seeking it, going a bit further afield and actually trying to make sure that we are supporting each other in our own organisations, whatever that looks like. I think when I've conducted exit interviews with social workers in the past, it's often been that they haven't been supported. So it's really important that we do support our workforce too.
Thanks, Kate. And Beverley, I know you've talked about that sort of diversity of role in the profession can really encourage people to stay in the profession. We've got a couple of minutes and then we'll finish. But yeah, just keen to you to touch on that.
Thanks very much, Matt. I think I agree with everything Kate said, but I also want to emphasize the role of leadership and managers in this area. I think it's really important to use the tools that we have, such as supervision, etc., but also to be cognizant of the challenges of some of our young recruits into the sector, and so in terms of diversity and some of the challenges they're facing. The social care res has some statistics around ASYEs, around bullying allegations, etc. We need to open our ears to the challenges some of our potential workforces are experiences, and really be committed to be doing something about it. The challenge of not being able to see the sort of career progression pathways that's possible for people. And I just really want to tell you a little bit about what we're doing in Haringey in terms of recognizing from our pool of people who aren't qualified, people who we can support onto that professional pathway for careers, people who've demonstrated the potential. They may be working in our communities, they may be working in the voluntary sector, but we're really committed to actually growing our own and actually espousing the values that we know will help keep people within our workforce. Thank you.
Thanks, Beverley. Yeah, go on, Colum.
Yeah, sorry, I know we're coming just to an end, Matthew, but I just wanted to reinforce that as well. I think there are 2 or 3 key things. The leadership's absolutely important, and the sort of environment that's created for people is absolutely crucial for social workers. But I think there's a couple of things. I mean, the retention question is interesting in the sense that the register is going up. So there are more social workers now registered with Social Work England than there were when we started. And so it's about where they are and what they're doing. And we want to do a bit more work on the data that we have to be able to track and be able to give that information back into the sector to help with that. But I also think key to this is how we care for our young social workers, our newly qualified social workers. I think that's a really important area that we haven't quite got right. And I would want to encourage and support how we care for people early in their years, because it's clear that if they can stay for the first few years, if they get really engaged in practice in those years, they will stay longer. And Kate's story is testament to that. So those are the sorts of areas I think are really important that we start taking more care of.
Thanks, Colin. And thank you to all the presenters. It's been absolutely fascinating and inspiring to sit and listen to everyone talk this morning. I'll end actually on a comment that has been posted into the chat, which does say that listening to you all speaking just inspires me to stay longer in social work. So if we take anything from Social Work Week, if Social Work Week achieves anything, we've kept hold of one more social worker, and that's a massive positive that I think we can take. But I think that's testament to what's been talked about this morning. I am a social worker, incredibly passionate social worker, and it's always inspiring to hear social workers talk about how passionate they are and passionately driving the profession forward. There's some links that have been posted in the chat to evaluate this session and to provide us some feedback. So I encourage everyone to do that. Click on that link and it'll take you off to an evaluation form, which has got a few questions that'll really help us improve in future social work weeks. There's a QR code on your screen there, which is very fancy, which takes you off to a different survey, which is just for social workers. And that's a survey that we're running over the next few weeks. So I encourage everyone who's a registered social worker to feed into that. The session has been recorded. That'll be shared on our YouTube channel sometime in April. I won't commit to a date, but it'll be shared sometime in April, so you can watch it back. And just a little reminder to anyone that is a registered social worker that has attended today, this can be used as part of your CPD, and would encourage you to do that. We as the engagement team will take away all the questions that have been asked, and we'll look at them and look at themes and look at how we weave that into future work that we're doing. There's been some incredible questions asked that we've just not had the time to get to. Huge thanks to everyone. Huge thanks to all the presenters, and sign up and take part in all the other sessions that are happening across the week. But really appreciate everyone's time. Thank you.
Thanks very much. Well done, Matthew.
Thank you.